Hi, my name is Neely, and this is Sam in Jersey, and we're here today to talk to you about the benefits of pet therapy. Some of you may be wondering, what is pet therapy? Yes, and pet therapy is used when animals are used to facilitate the well-being of patients. It can be the physical well-being or also the mental well-being. The first documented use of pet therapy was in 1792 at a facility called York Retreat in London, England. Florence Nightingale also made reference to pet therapy in her book Notes in Nursing in 1860 when she discussed the benefits of a caged bird helping a confined patient. In the last 50 years or so, pet therapy has really been explored more in modern medicine. Dr. Doris Levinson, in 1960, when a child psychologist documented the first use scientifically for helping a child to overcome some fears during therapy. And what Dr. Levinson found was that when a dog was used during the therapy, that the child was able to relax more and open up. More so, we found that pet therapy can be used in many situations. It can be used in hospitals, hospice situations, short-term rehabs, nursing homes, and residential facilities. Some people want to know exactly what kind of animals can be used during pet therapy. Now, dogs are the most common one. However, cats can be used, fish can be used, birds, even horses. It really depends on the type of facility and the location of the pet therapy. Because, of course, you definitely wouldn't want to take a horse into a hospital, not unless it was a miniature horse. Now, the benefits of pet therapy can be physical as well as mental. Now, the physical really is when we try to get the patient to engage in physical activity with the animal, such as walking a dog or participating in the grooming. The patient is going to benefit from the physical activity, but they're also going to benefit from the mental as far as being needed and being wanted by the animal. We also found that in nursing home situations and long-term care facilities that the residents there really benefit by this, having the animals around, that they felt like they were able to give back, that they felt needed, and increase their wanting to do more and to really their just participation in their activities of daily living. One of the physical side effects of this also was a decrease in blood pressure. We found that during stressful times or painful situations, when a patient is allowed to interact with an animal, that stress level goes down, the anxiety goes down. Because of that, noticing that the blood pressure would go down, the physicians decided to study this in patients who had cardiac disease. Studies have shown that it was very beneficial. One study by Dr. Rebecca Johnson, who has a doctorate in nursing, she is the Milhouse Professor of Gerontological Nursing at Sinclair School of Nursing, found was using it in cancer patients. These cancer patients, after visiting with the dog, said it was definitely beneficial and helped with their anxiety during their treatment times. So overall, pet therapy can really be used in many situations. It helps the patient. It also helps the handler of the animal. It gives them something to do as well as the animals. Many of these animals come from humane societies and pet shelters, so it gives them a new lease on life also. The biggest thing we have to consider when doing this is the animal's temperament. Are they going to do well in the situation, as well as the patient's ability to interact with them and whether the patient would like to interact with them. So taking everything into consideration, pet therapy is a great complement to modern medicine. Thanks. And this is my audience. My kids.